Good evening. I'm Dr. Martha Rodriguez. I'm the medical director here at MMR Healthcare in Boynton Beach. I'm privileged to be joined by Dr. Genevieve Hale. She's our pharmacist, in-house pharmacist from Nova University who practices with us. Welcome, Dr. Hale. Thank you for taking the time to do this.
Happy to be here.
Thank you. Today's subject is going to be CBD oil versus street-bought marijuana. We have been having patients come in, elderly patients that have not been able, they claim not being able to afford CBD oil bought medicinally and are going to the street to buy pot, thinking that they're doing the same thing. We have huge concerns about that, and Dr. Hale, who is very good in research, brought us a very simple source and very eye-opening that she would like to discuss with us. Before we do that though, Dr. Hale, what is your thoughts about CBD oil?
So CBD oil, I think, is what we need to focus on when we're thinking of medicinal marijuana. So CBD has a lot of good things that come with it. Some being it helps children with epilepsy, helps with nausea and vomiting in patients who have cancer. This is the part of marijuana that's useful for the pain and other neurological benefits that we look for when we think of marijuana. So CBD is a good component of marijuana.
And when sold to patients, it's regulated and is made in the lab under supervision of people like yourself,
yes,
who really know what's in there.
Yes.
Okay, so then that unfortunately is quite expensive because it's not covered by insurance, and patients are having to sign up in special clinics. And even to start, they have to put out as much as $250.
Yes.
I know that's scary because it's expensive,
yes,
but what are your thoughts about the patients that are not thinking that they're not able to afford the CBD oil and are going to the street to buy marijuana?
Yeah, so you're taking a huge risk when you're looking on the street for marijuana. I do understand that the cost is a problem. However, with that said, when you buy marijuana on the street, the thing that's not regulated that we are concerned about is THC. So this is another component of marijuana that can cause negative effects. Even things such as depression, anxiety, in some cases we've even found schizophrenia being led with this. And because of these things, you're putting yourself at a huge risk when you're buying it on the street. So even though, yes, it's probably less expensive on the street, you're not helping yourself at the end of the day.
So you strongly discourage that?
I do.
Just as I do. And also,
yes,
what is your thought about mixing it with alcohol or prescription medication? I'm talking about the marijuana you buy off the street.
Yeah, so when you mix that with other medications and with alcohol, it's a recipe for disaster. Again, we don't really know what's in the marijuana itself when you buy it on the street also. So that plus alcohol, plus the medications you're taking, we don't know how everything's going to interact with each other. And in probably more cases than not, it's not going to be a good outcome. So the risk is just not worth it, in my opinion.
So what you thought could help is just going to make you worse,
exactly,
like any other drug,
correct,
especially when abused.
Correctly.
So Dr. Hale is very good at doing research and taking us to the source. When she speaks with a good source backing her up. So she brought us a dummy-proof source that we can all go to and see exactly what the government advises us to do about street-bought marijuana. Dr. Hale, can you talk to us a little bit about this source?
Sure. So it's called SAMHSA. It's samhsa.gov, and you can just go there and look at anything marijuana or other illicit substances as well. This is backed up by the Substance Abuse and Mental Health Service Administration, which is what SAMHSA actually stands for. So if you go to their website, you can find more very easy to read information about marijuana and other drugs as well.
And we will attach to the Facebook the link to this particular pamphlet, but again, you could go to the site and find all kind of information. So just to wrap this up, I'd like to go briefly over the questions around this pamphlet.
Sure.
The first one being, isn't smoking marijuana less dangerous than smoking cigarettes?
Yeah, so this is a common question that we get. The answer is no. It's even worse. 5 joints a day can be as harmful as 20 cigarettes a day, so a pack of cigarettes pretty much.
So to anyone, 5 joints will seem little compared to 20 cigarettes, but the harm of 20 cigarettes is less than 5 joints.
Yeah, it's pretty much the same thing, so it's not good.
That's scary.
Yeah.
So the second question, can people become addicted to marijuana?
Yeah, so this is a common misconception, and the answer is yes, you can become addicted to marijuana. Research confirms that you can become hooked on marijuana, especially psychologically.
Okay, and third and last question, can marijuana be used as a medicine?
So yes, it can. And in some states, chemicals in the marijuana plant are used to treat some illnesses or symptoms such as childhood epilepsy, like I mentioned before, the nausea and vomiting that's associated with cancer treatments. However, again, the unprocessed or the marijuana that you buy on the street is not recognized or approved by the FDA. And scientists are continuing to research medicinal use of chemicals found in marijuana even today.
Okay, and although there's several things here that open your eyes to very scary facts, there's one that really struck me and I would like you to go over it.
Sure.
And it's what can be in the marijuana that we buy on the street.
Yeah, so this is so scary. Marijuana can actually be laced with certain substances such as PCP, formaldehyde, or codeine cough syrup without you even knowing. Especially if you're smoking it, you're not gonna taste these things. And blunts, which are the hollow out cigars that you put marijuana in, sometimes even have crack cocaine added to them.
So, I mean, Dr. Hale, we really appreciate your expertise and your time to do this because we really want people to be aware of what the danger. This is not something we ever dealt with because this is usually a young people problem, but now with the approval of CBD oil, we're really having a big issue. So we really appreciate your time and we both want to again express our concern and our total disapproval for street sold marijuana in the elderly. We don't treat young people, so we're not going to talk about them, but in the elderly where falls are a huge risk, accidents are a huge risk, mixing of multiple medications are a risk, adding street bought marijuana puts a risk that we don't even know how to approach. Therefore, the only way we can advise you is to avoid it. And we strongly advise you to avoid it. Do you agree?
Absolutely. Just say no.
Yeah, we remain available for any questions that you have. We will learn together about this because again, it's not something we've ever dealt with, but we are willing to learn with you and take you to the source where you can get the information that you need before you make the decision to go out on the street and buy marijuana. Again, Dr. Hale, thank you, and I am Dr. Martha Rodriguez.
Thank you.